Today on Investigate TV Plus, it's a system meant to provide care, but for some, America's healthcare is a broken patchwork of rules and high costs.
And what was the price change?
So out here, it was $12,000.
And we reveal the risk many face as they try to overcome their debt.
I was devastated, and then the more I called trying to find out, to talk to somebody, hey, you can't do this, this is illegal. I heard from billing agents, this happens every day.
Plus, we go in-depth to help you navigate this complex network and examine real-life solutions you can put into action right now.
Then it's game on.
Setting aside your differences, some friendly banter, right? Some friendly competition.
We introduce you to a group of brothers hoping to inspire players to put down their phones and play.
Let's leave the world problems behind for a while. That's what we want to do.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
If you visit a hospital, doctor, or pick up some prescriptions, you put your life in the hands of the healthcare system. I'm T. Chappelle.
And I'm Lee Zurich. Our investigations have uncovered what's designed to heal is becoming increasingly inaccessible for many.
Factors like cost and the availability of services can be roadblocks, and the tangle of red tape while searching for care, insurance denials, and confusing jargon hinder those looking for help.
A 2024 Gallup poll found Americans' view of the quality of the healthcare system is at a 24-year low. That includes patients, families, and physicians.
Take the story of Frank Bifus and his wife diagnosed with a rare genetic disease.
To me, it was inexplicable how much we'd have to fight with insurance companies to get her coverage. And a lot of those fights we lost, and typically a lost fight meant she just didn't get the care she needed.
Or from the doctor's perspective, Dr. Karun Shah helped start a company in Kentucky that works as the middleman between insurance and hospitals to get denials approved.
Honestly, I don't think it's the fault of the hospital, it's not the fault of the physicians, it's not the fault of the payers, right? It's sort of the system that we're locked into today, and this is the byproduct of the system, unfortunately.
We recognize the issues here are many. Today, we want to focus on a few that families face.
More importantly, we want to seek solutions, including ones that could save you money.
But first, we need to introduce you to one woman who learned that moving from one state to another and going to a different facility can be costly, even with the same insurance provider.
Investigative reporter Carice Jackman takes a closer look at why this happens across the country and what you can do to price compare.
A new peaceful beachside hometown for Kelly Reardon.
So I've lived here about a little over 2 years. We just really feel like we're really part of the community out here.
Came with an unexpected surprise.
Well, I was actually shocked when I got it.
When she started paying for diagnostic tests that have become part of her healthcare routine.
And so I was calling family members and hey, is this normal? Is this right? And they're like, yeah, that's, it's high, but it's worth it.
The change in scenery from Alabama to North Carolina came with a major change in Kelly Reardon's healthcare bills for an annual breast MRI, something she says isn't optional, but potentially life-saving.
So I'm high risk for breast cancer. So my mom died at 48. So I'm definitely dense breast, but most women have that anyways. So definitely categorized as high risk. So just being checked every 6 months is super important, especially for me and everybody else in my family.
When Reardon lived in Alabama, she says she received her MRI at an imaging center and was billed around $1,100. Her out-of-pocket cost totaled around $650.
But then, moving out here, I just assumed it would be the same. Knowing hospitals are maybe a little bit more just because it's a different type of facility, but didn't expect quite the price change that I experienced with it.
And what was the price change?
So out here it was $12,000. So I was like, oh, okay, no big deal. They made a mistake with billing. They accidentally added a zero.
But it wasn't a mistake. Reardon went from being billed around $650 out of pocket to over $6,000. Consumer medical experts say that's because instead of going to an imaging center, Reardon received her MRI in North Carolina at a hospital facility. For For both procedures, Reardon was in-network, received prior authorization, and had the same insurance. She expected the price to fluctuate somewhat, but not this much.
I work in pharmacy, so pharmacy bills real time. So when you come to the pharmacy and you pick up a prescription, that's the price that you pay. There's no back billing. You don't get a bill that says, hey, now you owe an extra $1,000. With medical care, it's all billed after the fact. So I was probably 6 months later that I got this $6,000 bill because it's all back billed.
Unfortunately, before you get care, we don't often know how much it will cost. Unlike any other product you would buy where you know the price tag, more often than not, before a procedure, you don't know.
Kay Pastena is a vice president at KFF in Washington, D.C., a nonprofit health policy research, polling, and news organization.
For private insurance, each employer, each insurer has a negotiated rate with each provider. They have their own provider rate. And that's not often very transparent to patients.
Pastena says where you get your care can make a difference.
Most patients don't know you're often paying more to get that care at a hospital setting because of what are called facility fees. I'm not sure if that's the case in this particular scenario, but often a hospital is going to charge you an extra fee.
Reardon's hospital did not comment on her specific case, but told our investigative team it's important to note that the prices reflected in these estimator tools may not encompass all costs associated with the service and may differ from the actual cost. They added that they recognize the complexity of healthcare pricing and support patients with their billing needs. Reardon is now on a payment plan, but she worries for other women who are high risk, who aren't as fortunate.
I just feel for people that aren't as lucky as I am. I do have a good job. I have a company that helps pay for healthcare. I have people that I can talk to. To be somebody that just doesn't know anything, it just makes me really feel for people out there that just get the bill, and then, some people that could be the last straw for them.
Reardon's hospital added that in general, care within a hospital may be subject to facility fees, which cover the cost of hospital-based resources, staff, and infrastructure, all of which support patient care.
There is a bill proposed that would eliminate out-of-pocket costs for people like Reardon. The Find It Early Act would provide health coverage with no cost sharing for additional breast screenings for people at greater risk for breast cancer.
While Reardon explores that option, she now lives with the reality of paying off her medical debt.
A Gallup poll revealed in 2024, 31 million Americans had to borrow money to pay for medical care for themselves or someone else. It also found a majority are concerned they would experience medical debt if faced with a major health event.
Medical debt is not an indicator of how fiscally responsible you are. People end up with thousands of dollars in medical bills, not because they went on a spending spree or they bought a fancy car. It's because they got a cancer diagnosis or they were in a car accident.
For many, one option to tackle medical debt is a payment plan, as many medical providers, including dentists and vision centers, can work out a low or no interest plan for bills.
They said it was $700 and something odd dollars. And I said, well, I don't have that. Can I be on a payment plan? They said, sure, let me take a look.
That's what this woman says she thought she set up until she got something else in the mail she didn't expect.
I'm infuriated.
Still ahead, we uncover hidden costs and other solutions to get your bills paid.
Plus, it could be the cream of the crop for sensitive stomachs. We take you to the farm producing a different type of dairy.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
In order to pay for hospital bills and prescriptions, experts say a growing number of Americans are turning to medical payment plans or credit cards to pay off medical debt. And you should know there's a big difference between the two.
As we mentioned earlier in the show, payment plans are often little to no interest, which can depend on your income. As for medical credit cards, they typically have an interest-free period for 6 to 12 months. But experts caution that not reading the fine print could cost you.
An Arizona woman knows the financial frustration firsthand. She says she tried to sign up for a payment plan and was instead slapped with a bill for a credit card.
Reporter Susan Campbell digs into the dilemma so you can avoid the same, plus we show you more solutions to reduce your debt.
It's an old vintage.
Carrie Morgan is house hunting, getting ready to move to Texas.
Now with the credit hit, I'm probably postponed a few more months.
To understand that credit hit, we have to go back to January 2025. Carrie went to the ER.
They said it was $700 and something odd dollars. And I said, well, I don't have that. Can I be on a payment plan? They said, sure, let me take a look. They came back with like $30 a month. And I said, okay, perfect. They said, you should get an email.
A couple days later, she got an alert.
I got a hit on my credit saying somebody did a hard look at my credit. And of course I was freaking out, like, what is going on? And come to find out, it was Banner ran my credit and signed me up for a credit card to put the payments on.
Then a credit card showed up in the mail. Carrie says she never asked for this and never signed anything.
Not a thing. I'm infuriated.
On its website, Banner Health touts its relationship with a vendor that offers credit.
We are starting to see them marketed in more and more healthcare settings.
Patricia Kelmar is the healthcare director for the Arizona PERG Education Fund. She says medical credit cards could be really costly for consumers.
Oftentimes, they have a zero interest introductory rate, is what they call it. But the interest is significantly higher than you would see on a regular credit card. And if you miss a payment or don't pay it off, the full balance, in a certain period of time, the interest is retroactive.
There's another potential problem if you use a medical credit card.
Now you owe the money to a bank, not to the provider.
Carrie says in her case, that unwanted and entirely unexpected credit card dinged her credit score by 16 points.
I was devastated. And then the more I called trying to find out, like, to talk to somebody, hey, you can't do this. This is illegal. I heard from billing agents, this happens every day.
When we asked if this is a known issue affecting more people than Carrie, a spokesperson emailed us a statement saying Banner Health takes these concerns seriously. As a matter of policy, we do not discuss patient matters publicly.
Shake.
But Carrie told us after we reached out, the hospital wiped out an $814 bill and discounted another bill by 50%. Cure, the company that issued the card, also told us it will reverse that hard inquiry on Carrie's credit.
Look at the trees.
Now she can get back to her house hunt.
There are ways you can be proactive to find the true cost of your medical care before the bill arrives.
Some hospitals have price calculators on their websites that list the costs of procedures and equipment. It may also be helpful to ask your doctor for the specific billing code, as you could be met with complicated medical terms. Knowing the code allows you to look up that specific procedure and its cost. If you see a medical bill that doesn't line up, you may be able to dispute it.
Enacted in 2022, the No Surprises Act allows patients to dispute a medical bill if the final charges are at least $400 more than the good faith estimate, and it's filed within 120 days of the date on the bill.
Still ahead, meet the brothers' engineering enjoyment.
I think I've always enjoyed games a lot, and it came upon me that I think I can make one. I think I can make something different.
We reveal the inspiration behind this family empire of board games.
But first, these cows don't produce your typical milk.
So our kind of whole goal with breeding it was to give people an option to come back to the dairy case, to real dairy.
We explore a different type of dairy that allows some with digestion issues to enjoy the drink once again.
You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. It's free to download. over cow's milk. Many Americans are trading their daily dairy for alternatives such as soy, almond, and oat milk. Experts predict between 2024 and 34, the plant-based milk market will nearly double in value.
While people choose plant-based milk for a variety of reasons, many choose it because they're lactose intolerant.
Lactose intolerance occurs in people unable to fully digest the sugar or lactose in milk. Too little of an enzyme called lactase produced in the small intestine is typically responsible for lactose intolerance.
But for those with sensitive stomachs who miss the taste of a real glass of cow's milk, a return to dairy could be possible.
Reporter Natisha Lance shows us how.
On a picturesque dairy farm in Lincolnton, North Carolina, cows are grazing and curious.
So we have had Jersey cows in our family for over 100 years.
Riverbend Farm opened back in 1997 with a creamery built in 2021. The main job for more than 200 Jersey cows on the farm is to produce milk that is used to make ice cream and milk that is sold at the farm and in grocery stores.
Right now we are bottling some of our whole milk.
About how many gallons will be processed here?
So typically right now we're doing about 2,000 gallons twice a week, and then probably, I would say, another 500 or 600 on Fridays, so a couple thousand gallons a week.
But it might not be the milk you're used to drinking.
The Jersey cow is predominant for producing A2 beta casein protein,
commonly called A2 milk.
It is typically easier for digestion. So a lot of times people that have trouble digesting dairy are intolerant to the A1 beta casein protein.
An estimated 50 million Americans experience lactose intolerance, but now studies have shown it might not be the dairy itself that causes digestive issues, but instead the A1 protein found in most cow milk. That's why some people are turning to A2. Riverbend started only producing A2 milk about 8 years ago.
We knew that there would be a place on the market for it. So our kind of whole goal with breeding it was to give people an option to come back to the dairy case, to real dairy.
Both A1 and A2 milk have lactose. Despite many people turning to alternatives over the years, a nutritionist says dairy milk can benefit most people's diet.
They contain a fantastic source of protein and lactose, which is, comes from a variety of different sources within the milk, the protein itself, but it's full of vitamins and minerals, things that you can't really get from a lot of other food sources.
Riverbend hopes to give people who want to keep drinking milk another option without the risk of tummy issues.
Still ahead, when it comes to fun and games, these guys are all business.
To make some games that stick around as long as like Uno and all the other ones we've mentioned would be great.
We introduce you to the group with a knack for inventing board games.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms.
A group of brothers and their friends say they're on a quest to create a board game empire in their own backyard.
Reporter Kim Clark introduces us to the brains behind Buddy Pal Games.
In a world where everyone seems glued to their screens, these guys are determined to bring back face-to-face fun.
Camaraderie, I think, is the number one thing.
Kenny Smith prioritizes playtime these days with his brothers, friends, and a growing group of board game enthusiasts.
Setting aside your differences, some friendly banter, right? Some friendly competition.
Right.
But just let's leave the world problems behind for a while. That's what we want to do.
Kenny, his brothers Keith and Kirk, along with lifelong friend Jay Malinowski, grew up playing games together in Horn Lake.
We played lots of games. Our dad taught us chess and other games, and we've always kind of had a affinity for things like that.
And then I grew up next door to him, and that was in 1982 or 81, and we just became friends and played out in the cove and played games all our lives together.
Roughly 30 years ago, the guys decided to turn their passion into product.
we just got connected and started ideas again with Keith, and then that's how Buddy Pal was formed.
Buddy Pal is the creative collective behind more than a half dozen games so far. The company's name, a nod to the brothers' old man.
Our dad called us Buddy a lot. Buddy, do your homework. Buddy, do this. Buddy, do that. We had this little Buddy Pal song we made up and sang. So
wait! You can't go tell me about a Buddy Pal song.
No.
Sing the Buddy Pal song.
No. Buddy Pal, Buddy Pal, Pal. That's it.
John Childress became a Buddy Pal in 2018 in the lead up to the company's first release.
Okay, so the first game we did was called Seven Ghosts, and so he just called me in to do the artwork on that game, and I've just been around ever since.
Their dice and card combos cover everything from spooky ghost stories to jungle adventures, party poppers to power decks.
Real quick, easy, fun games. So we try to come up with all different kinds, whether it's really deep thinking strategy games or quick, easy, fun math building games.
The possibilities really are endless.
To make some games that stick around as long as like Uno and all the other ones we've mentioned would be great.
And Snake Eyes!
We're hoping with the games that kind of unplugs people from their tablets and their phones and just sit, like Ken said, just sit around the table and have fun playing a board game with your family.
Well, they look like they were having so much fun. I love a board game, especially Monopoly, and I can get the shoe. That's my favorite piece.
Maybe Boardwalk and Park Place. That doesn't hurt some.
Those are some good properties to have.
Pricey, not good. But I love that. Just kind of almost feels like a homegrown games in that story there. So nice.
Maybe they'll come up with the next Monopoly.
They might. They have some good ones there.
Well, that's it for us on Investigate TV Plus. I'm T. Chappelle.
And I'm Lee Zurich. Thanks for watching.
On the next Investigate TV Plus, when it comes to the world of fast fashion and content creation, designers say imitation is not a form of flattery.
So when I talk about stolen designs, I'm not just talking for me, I'm talking for every single independent designer out there who does not have the voice and the platform that I have.
We uncover what some call fast fashion fakes and explain how artificial intelligence can play a role in the deception.